So the question is 53. A 28-year-old female, gravida 2, para 1, live 1, with history of previous LSCS, previous cesarean, presents to the gynecologic emergency in the live. On examination, she is hypotensive, fetal heart sounds are absent, and fetal parts are easily palpable. So what is her diagnosis? Oligohydramnios, abruptio placenta, uterine rupture, and H-mole. So the thing is that we have discussed it in detail in 52nd question, the last question, and so the 52nd and 53rd questions are almost same with same answer. That is, here the answer will be uterine rupture. The thing is that there is previous LSCS, previous cesarean section, then the patient is in labor, then patient is hypotensive, then fetal heart rate, fetal heart sound absent, and fetal parts are easily palpable. So they are easily palpable. So it means the fetus is in the peritoneal cavity. So when the uterus ruptures, the fetus may partially or completely escape into peritoneal cavity, making fetal part abnormally easy to palpate, and fetal heart sound will be absent and maternal shock will be present. So in that case, the answer will be uterine rupture. The thing is that similar type of presentation can be present in the abruptio placenta. But why is it not abruptio placenta? Because abruptio placenta causes painful bleeding. So it will present with painful bleeding and hypertonic tender uterus. But in that case, fetal parts are not easily palpable. So it means that the case which is given in question, the uterus has ruptured. But in the case of abruptio placenta, the uterus is not ruptured. So when the uterus is not ruptured, the fetal parts are not easily palpable because fetus is not in the uterine cavity. So this is easier one. So 53rd answer will be uterine rupture. Going to another question, 54th. A 24-year-old primary gravida comes to ANC clinic at 8 months amenorrhea. Her BP is found to be 160 by 100 mm mercury. So BP is elevated, BP is increased. Lab findings reveal thrombocytopenia, means platelets are decreased. Increased SGOT, SGPT, it means liver enzymes are increased. And increased LDH, it means hemolysis is there. What is her diagnosis? Obstructive cholestasis, hepatitis B, HELP syndrome, or eclampsia. So answer will be HELP syndrome. So what is the full form of HELP? HELLP. E for H for hemolysis, L for elevated liver enzymes, and LP is for low platelets. So the findings of hemolysis in this case is increased LDH. So hemolysis is indicated by increased LDH. So increased LDH means hemolysis is present. Elevated liver enzymes can be seen by increased SGOT or SGPT. So SGOT and PT are increased, and low platelets shown by thrombocytopenia. So everything is mentioned here. So this will be HELP syndrome. Undoubtedly it will be HELP syndrome. Thing is, the BP is elevated. Can it be eclampsia? The thing is, eclampsia will have a history of seizure. And the patient is not presenting in the ANC clinic. She will be presenting in emergency with seizure. Now coming to next question, question number 55. A patient who is 2 months pregnant, it means it is early pregnancy. So 2 months pregnant, reports to a hospital with complaints of increased vaginal bleeding. So there is early pregnancy, vaginal bleed, and pain in the lower abdomen. So there is pain in the lower abdomen. Internal examination reveals dilated internal os. So internal os of cervix is open, it's dilated, and product of conceptions are felt through it. What is her likely clinical diagnosis? So the answer is inevitable abortion. This is inevitable abortion. Why is it inevitable abortion? Because all the features of that, there is bleeding, there is pain, cervix is dilated, products may be felt through os, and expulsion not yet complete. Not yet complete or even not started. So expulsion not even started. So this is inevitable abortion. So answer will be B. Why it cannot be other options? Let us look into it. So the first is threatened abortion. Why is it not threatened abortion? In the threatened abortion there will be bleeding, but cervix will be closed. But in this case the cervix is dilated. So it means this is not threatened abortion. Coming to the septic abortion. Septic abortion will have the features of fever. So the patient will come with fever, with a foul discharge, and toxic features. There will be toxic features. So these three things will be present in the case of septic abortion. Now coming to the fourth option, why is it not incomplete abortion? So incomplete abortion it will be mentioning that some products are already expelled. So the question say some products already expelled while some products are retained. So it will be retained, products remained. So that's why it will not be incomplete abortion. There's also one thing which is not given in this option, like complete abortion. In the case of complete abortion, the cervix will be closed and all the products are expelled. So if we talk about these types of the threatened abortion, inevitable abortion, incomplete abortion, or complete abortion. So cervix will be closed in case of threatened abortion. So cervix has still not opened, while in complete abortion it will be closed. That's the abortion process has been completed, and that's why the cervix is closed. So in threatened abortion, the cervix will be closed because the process has not yet started. And in the complete abortion, the cervix is closed because the abortion process has been completed. While in the case of inevitable abortion, the cervix will be open, and in incomplete abortion, it is open. So in threatened abortion and in the complete abortion, it will be closed, while in inevitable abortion or incomplete abortion, the cervix will be open. Now, products of conception. In the threatened abortion, it is inside uterus. In the case of inevitable abortion, it will be felt through os. In the case of incomplete abortion, it will be partially expelled. While in case of the complete abortion, it will be all expelled. So these are the types of abortions.